Pam, I get to spend a lot of time on Reddit and Facebook listening to people with their TMD issues. And it is so interesting because they keep asking the same questions. So, one of the questions they keep asking is what is the difference between a night guard and an orthotic? Would you please give them the answer?
Okay. Well, let me answer that with a question, of course. First of all, how many pictures do you see of broken night guards on those
You see a
platforms?
lot of those where they have the night guard in their hand and say, which one is this?
Like every time I'm on there, I see like broken night guards because night guards are not meant for TMJ dysfunction. A night guard is something that we're all taught in dental school. And what it is that the dentist either puts that gooey stuff in your mouth or they take an oral scan and they build this appliance that goes on your upper teeth normally. And it's flat. It's not built to anything other than just a flat plane. And it's usually bulky. So it's typically made for grinding. Yeah, it'll protect your teeth from wear and tear because it's so thick and bulky. But remember, a lot of times patients that have TMJ issues, they also have sleep disorder breathing issues. So if you're putting something in your mouth that's bulky, it's going to further occlude your airway and might exacerbate or make your sleeping issues even worse, maybe even full-on sleep apnea. So a night guard is not meant for joint discomfort. It's meant to keep you off of your teeth. Mac, we haven't done those in over 20 years because I always felt like they did more harm than
They
good.
do.
And did you ever have situations where a night guard actually triggered TMJ pain?
Especially if it's on the upper and it has a ramp in the front, because when you bite down, it pushes the jaw back. And when you push the jaw back, you're going to push the joint back. So the thing about an orthotic is it is takes into consideration this joint position, whether it's in the right place or whether it's compressed. A night guard is going to compress sometimes, like you're saying, it's going to compress the joints, it's going to compress the airway. So what an orthotic does is find the right position between the lower jaw and the upper jaw, putting the joint in the right position, and then having the bite in harmony with the upper teeth. So it's very scientifically made for that individual. A night guard is just a piece of plastic,
It's
a
not
piece
even
of plastic.
apples and oranges. It's
It's
like
very,
apples and cactus.
but
Like
here's the problem. Here's the problem. They look alike.
they look
They
alike
look alike. My
because
glasses look alike, but if I wore your glasses, it wouldn't work.
oh, that's so beautifully said. That's exactly right. The only similarities that they fit on the nose and they go in front of our eyes, but they do not do the same thing. So beautifully said. An orthotic is built to decompress the joint.
Yes.
TMJ dysfunction occurs because of joint compression, period. So we want to decompress the joint. A night guard does not do that. Sometimes it magically helps, okay? Weird things happen, but it's not the intent of a night guard. And that's why people grind on their night guards and they break them. Make sense? Uh,
Makes sense.
Here's another common question that I see. I don't know about you, but okay, should I do surgery or should I do TMJ treatment? Have you
Oh, wow. That is a big one. And they say, I've got to get an MRI. I've got to go to the oral surgeon. I got to have them operate on my joint. Anytime you operate on something, you have a chance of really messing things up. TMJ treatment done correctly, especially by a neuromuscular dentist, is going to be the most natural, safe way to do any kind of treatment. If you break your leg and you put it in a cast, it is going to heal if you're healthy. If you take a joint that is compressed, it's bent, it's out of shape, it's remolded, and you put it where it is not getting all that pressure on it, guess what? The body's not going to heal it, but it's going to remold it to where it's functional again. So you can take an unhealthy joint that's been eaten up by a thing called osteoclast, and you can bring that jaw forward, let it stay there in a harmonious position, and the body will remodel this, and no surgeon has ever touched it.
hmm And I think what is it? It's more than one and two TMJ surgeries end up failing. And then
Yes.
all of that maybe 50% that are successful, which we know is not 50%. I think it's actually closer to 30%. We don't know how many years they last and how often they have to be retreated and what their success rate is like. Yeah, so I agree with you. Surgery versus TMJ treatment, I would always go with neuromuscular based TMJ treatment.
But let's clarify. There's two types of surgery. There's joint surgery, which you and I are talking about, and there's another surgery where they have to, when the jaws are so disfigured that they have to be surgery to kind of to be put back together again. Now there are times that that is
Matt, let
very
me
much
interrupt you
needed and
because
great.
not our listeners can't see you, right? And the way
Uh,
you're moving your hands,
yes, I'm sorry.
worded is disfigured. What you're saying is that they're so far set back. Like people say, retreat.
Right.
The mid face or the maxilla is retreated and the mandibles retreated, and then go on. The surgery does what?
Yeah, so you can have joint surgery, which you and I don't agree with
Right.
because it fails and it's just not necessary. And then you can have jaw to jaw surgery where you line up the upper jaw and the lower jaw, and you have to take the teeth into consideration. So this takes a very intelligent, very experienced team to be able to do this, but it is doable, and sometimes that is very necessary.
Yeah, that's called an MMA procedure or a maxillary mandibular advancement procedure, which I am not against at all, and I think there's a really good time for it. It's fantastic for people who have obstructive sleep apnea with very retruded faces, like you're saying. And also, if people just don't like their facial aesthetics, they want everything to come more forward because it's so far set back. When they have MMA surgery, Mac, remember that does not change the joint position at all.
That's correct.
So those patients that usually come in wanting better facial aesthetics also have sleep issues and joint dysfunction. I'm like, okay, what are we attacking first? Is it your joint pain and dysfunction, or is it your facial aesthetic or sleep issues? And if it's facial aesthetic or sleep, I'm saying, okay, go to this oral surgeon and do this MMA procedure, celebrate that success, see how you feel afterward, let the body calm down. And when you calm down, come back to me for orthotic treatment of the joint because
And then you deal with the joint. Okay,
exactly.
so let's throw in here ICMO, the International College of Craniomandibular Orthopedics, which you and I are both board members.
Mhm.
This college is for dentists like you and I, all over the world. And in this college, you have a fellowship, which you just got yours in Japan
Yes,
a
I
couple
do
of months ago.
much.
Congratulations. I've had mine a few years. And you have a mastership. What that means to you, the listener, is that these doctors have been vetted. They had to take tests. It's not really a test, but they have to turn in cases to prove beyond a doubt that they know what they're doing.
Right.
And go to ICMO.org and find you a dentist who has been vetted and has their fellowship or their mastership.
Yeah, thank you. Always, we need to do that every podcast because people still can't find doctors that can help them. And that's the whole point of this open up discussion is to get people to understand, open up their mind to what could be, and then find the right doctor that can help treat them. Um, I got another question that I've constantly come across,
Listen to you.
well, because I have a wonderful doctor associate that works with me and she does Botox for
Mm,
TMD. And there's now this whole TMD Botox protocol. And I asked her to be a part of our team because not everyone can afford my treatment, and
true.
not everybody wants to go through treatment because maybe they just had a baby or they're dating or they just don't want to go through treatment. They want a quick fix, like a relief. And it is a medicinal relief. So, what are your thoughts about Botox versus orthotic treatment?
So I'm not experienced in that. I did not get into the Botox craze.
Looking at your
And
face, nobody would know that though, Mac.
listen, well, now, okay. So both
While I get you.
the biggest problem in my rural area is people being able to afford proper TMD treatment. It's huge. It's real. So there's real two issues. One is finding a dentist that knows what they're doing, and the second one is being able to afford it. No
Yeah.
question that that's a huge, huge problem. So some doctors sit on their pedestal and say, well, Botox just gets rid of the symptoms. It doesn't get rid of the cause. If you're in pain, really all you're caring about is the symptoms.
Right.
Get this pain, get it away from me. Get me out of this pain. I'll worry about it a month or two later if it comes back. So I would be fascinated to know about Botox because I'm thinking that people who have been in this pain for so many years and they're so twisted up and they're so wound up that you have to have something to at least get them to relax, to get them down the road to something that they can afford and something that works and doesn't relapse. So your massages relapse, your Botox relapses, your chiropractic experience relapses. What you and I do with the right patient, the right way, doesn't relapse.
Correct.
And, it is expensive. Running a dental office is horribly expensive. And unless you're a dentist, you don't understand that. It's beyond comprehension of understanding how expensive it is for us to do these things. I think it's unbelievably fantastic that you have that service.
Well, you and I are hardcore in trying to help people solve,
Yes.
resolve their problems. And, one of the biggest frustration for me is not giving them an opportunity to do something when I'm outside their expense or time, right? And I love how you said that. So having Dr. Myers, her name, being able to do this protocol, and she's the best in her area at doing it. It's incredible to watch it, especially for someone who never did it herself. Um, where she does her injections are on all the elevator muscles, meaning the muscles that posture your jaw in that closed position, specifically the masseters, which are right on your, the angle of your jaw, and then your temporalis, which is on the forehead. For those of us watching, you seeing us point out.
Now
Um,
you are talking about the chewing muscles, right?
the chewing muscles, right? That's exactly right. So it relaxes the muscles. It won't let you, quote, recruit or be so intense with how much force you can put on those muscles, especially for clinchers. So when somebody is a clincher, I think they do well with Botox. But if somebody's a grinder, I don't think it always helps with their symptoms. That's what I'm finding. And I don't think anyone's really talked about that yet. But seeing what's working and why some patients need to come back more frequently. Um, that's what I'm seeing the difference between the two. So Botox is a good option. Patient selection is important. Like you said, it's therapy. It's not a solution, meaning it helps with pain, just like chiropractics. It can, not all, but some can, and same with muscle therapy, massage therapy. But aside from that, you guys always also have to realize that when you do Botox, if it's not done correctly, it can actually make your TMJ symptoms worse because these same muscles, these chewing muscles, as you said, Mac, they're also the ones that are posturing and moving your jaw the whole time in space. And if you paralyze them, incorrectly, you're going to lose jaw function and support, and it can exacerbate the situation, almost give you locked jaw. So I'm not trying to scare people. I want you to know that's an option. But again, you've got to do your due diligence and find the right doctors to do it, right?
So let me throw something in there because you have every tooth has sensors. They're called periodontal ligaments. And these sensors tell the brain that things are not right,
Hmm.
just like a car sensor, just like a tire sensor. And so Botox does not interfere with those sensors, correct?
Correct.
So if your muscles have been incapacitated or they're not working like they're normally, even though they have been relaxed, you still clench, the sensors and the roots are going to pick that's they're going to know something's wrong. And
Correct.
they're going to tell the brain. And you
Correct.
don't know what's going to happen when it tells the brain because the brain
Correct.
is going to decide what to do. So you're stepping off into unknown waters, some of these things, if you don't know what you're doing.
It's a little bit of a gamble, right?
Yeah.
It is. And there's a product called Xeomin that she uses, which is, quote, the clean version of Botox. It just doesn't have some of the nasty preservatives that the other ones have. So she tries to keep it as clean as possible, but it is a paralytic and it's a toxin. So is there a place for it? Sure. And I want our patients to know. And one last thing on the whole clinching versus grinding. Clinching is a static constant hold of a muscle. It's like an isometric contraction, like people who just bear down. Sometimes we do it exercising. A lot of times we're doing it at nighttime and not knowing it. Grinding is when you're actually wiggling the jaw side to side, and that's usually because of a muscle or tooth like bite imbalance, without getting into too much detail. But why am I bringing this up? Because a lot of patients are on SSRI medications, which are selective serotonin reuptake inhibitors, meaning, I know that was a mouthful, but meaning that it's like a ton of these antidepressants. Like the most common are like Prozac, Lexapro, Zoloft, Celexa. Those are all SSRIs. And so some of our patients are like, I clench all the time and I can't relax. And I've been doing this Botox at this place and I'm getting worse. And I'm like, well, what medications you're on? Because again, you have to have the time to do a proper intake and talk to your patients. And I find out they're on an SSRI for depression or anxiety. And I'm like, the one of the most common side effects of this is clenching. You know,
Right.
and you will not stop clenching until you get off that medication. And the great news is that you can get on a different medication to work with antidepression and anti-anxiety, but it doesn't need to be an SSRI. So listeners and watchers, ask your doctors if you're on an SSRI, maybe to modify your medication. That alone might be helpful.
So to throw in how complicated what we do on a day-to-day basis, the TMD patient on a clincher and a grinder, if you want an analogy, the clinching is taking a nail and a hammer and nailing it straight down. Grinding is taking the hammer and going from the side and knocking the nail from the side. So then that's when you start destroying teeth, when you go from side to side. And your dentist has to know all this. You can't just make, quote, a night guard. You
Yep.
have to make a very sophisticated neuromuscular orthotic. So your night guard is your is your glasses frame, and your orthotic is the lens that you see through.
So I think again, I hope this helps shed some light on all these questions that are floating out there. And it was quick and easy. And guys, if you want something that's going to help break things down a little bit more substantially, but super easy to digest and understand, that's what Mac's book is for. So go out on Amazon and buy it. Right, Mac?
It's TMJ Trifecta.
Yeah.
It has many, many answers, all the things Pam and I have been talking about.
All right. Till we meet again.
Again.